You may be dealing with some pain in your elbow, your wrist, your thumb, and your hand, and you're wondering, is there a brace or sleeve that I can buy to help alleviate these symptoms? In this video, I'm going to give you my doctor's guide as to which brace you should consider and for what conditions they're useful for. For those who don't know me, my name is Dr. Sonam and I'm an interventional sport medicine doctor located up here in Canada. So in this video, I'm going to show you some samples of different types of braces, and I will also provide some links down below in case you're interested in looking at them. I do encourage patients to make sure that they try these braces on so that they can get the best fit available for themselves. We'll start from the elbow first and move down the arm. So the first type of brace I recommend for use with elbow issues is a Counterforce Traction Brace. So these are just two different types from two different brands. But let me show you how they work. So how this works is actually you apply this Counterforce brace 2 to 3 inches below your elbow bone. And it can either be used on the outside or on the inside aspect of your elbow. Now here I have it on the outside, and what it does is it offloads the tendon attachment at this point. So very specifically, this Counterforce brace is what we recommend for medial and lateral epicondylitis. So think about your medial and lateral tennis and golfer's elbow. The reason why people get tennis and golfer's elbow is there's pain at the bony insertion of the tendons. And because the tendon isn't strong, it's causing a lot of inflammation and pain. How this brace works is it provides a new fulcrum of support. So what happens is there's pressure applied here, which means the tendons will start to work here and give this poor little guy a break. So this is one of my most popular recommendations I will make for patients who are suffering from tennis elbow. Can be used during rehab, also for prevention during activity. Next, we have a mild compression sleeve for the elbow. So this here is an elbow sleeve that's providing medical grade compression. So basically you apply this over the joint, and in some formulations you'll also get another strap that kind of works as that Counterforce strap. How medical grade compression works is once it compresses the joint, your proprioception of the joint, so your ability to sense the joint in space through your brain, goes up. So you become more hypervigilant of the joint, and because of that there's more stability and more activations of muscles around there. This is also very effective in those with some swelling in the joint because the compression helps to remove that swelling. With this specifically, it will also come with an added strap. So if you wanted to use this as a Counterforce traction brace in addition to all this compression, you can as well. Now, who is this brace for? So think about some mild irritation at the elbow joint, some mild arthritis in the joint, and even you can still use this for golfers and tennis elbows because it does come with the Counterforce brace option. The nice thing is it's not rigid. You still have good flexion, extension, and pronation and supination of your arm, so you can still use this while you're working or while you're exercising. So it's a very good active form of bracing. My last elbow option is this ulnar nerve splint. So let's quickly talk about why I would use this first. So that splint is used for patients with ulnar neuropathy. And typically the ulnar nerve is our funny bone nerve that comes all the way down here and provides sensation to the last 2 fingers of our hand. So our D5 and our D4, pinky and ring finger. Typically, people will find that when they're sleeping, they can wake up with numbness and tingling in the last 2 fingers. And that happens because we sleep with our elbows bent and we're putting a lot of pressure at the nerve here. So the way that we treat this is we ask people to keep their elbows straight when they're sleeping. That's where this splint comes in. So let me show you how we put it on. All right, so that's it. This is how the splint is put on. As you can tell, I cannot bend my elbow. So it can be put on in different variety of different areas, but basically, it prevents you from bending your elbow. It's a very soft splint, so it doesn't provide any pressure points, but while you're sleeping, it prevents that elbow from bending. And the hope is if we prevent the elbow from bending, we're preventing pressure being put on the ulnar nerve, which will help heal that nerve and improve your symptoms. Now, moving down the arm, let's talk about some wrist braces. So this here is our soft compression splint. So like I've said before, this provides medical grade compression to help provide that increased stability to the joint. So let me show you how it's put on. So basically, when you put this on, it applies pressure to the upper forearm and also the wrist joint. This can be very effective for mild wrist injuries. So think mild arthritis, mild instability, mild tendonitis, and it can also be used when exercising for individuals who find that they have a little bit of wrist pain. Now, some of these braces will come with added levels of support. So this one specifically actually comes with an added strap. So think about how boxers will also wrap their wrist from a stability standpoint with these boxing wraps. This is very similar. So what you can use the strap for is to provide that extra level of figure 8 support that would give you that support in that wrist as you're moving around. So this can be customized to the level of support that you need. It can just be the compression itself, and it can be the compression with the added benefit of the strap. And this is a very good first line option for individuals who are having some wrist pain, who are having some wrist tendonitis, and who want to help limit the flexion and extension of the wrist a bit to help allow the wrist joint to heal. Next, we're moving on to the more rigid wrist splints. So as you can tell here, this is my rigid splint. I can't flex it, I can't extend my wrist, I cannot ulnarly deviate, and I cannot radially deviate, but I can move my thumb, so you still have opposition. So this here doesn't allow the wrist joint to move very much, and it's used for more serious wrist issues. So what would we use this for? Think arthritis of the wrist joint, wrist flexor or extensor tendonitis. This is also very effective in carpal tunnel syndrome, because in carpal tunnel syndrome, the nerve here gets pinched at night because you're sleeping and you're compressing it. So we recommend with carpal tunnel syndrome to sleep in this to help keep the nerve straight so that there is no pressure point that's created over the nerve at night while you're sleeping like this. The other thing that this can be very helpful for is post-operative repair. So if the surgeon needs you to be in a brace afterwards, they'll recommend one. The key thing to know about these rigid braces is that they can stiffen up your joint if you're using them unnecessarily. So just be careful and chat with your doctor to see if this is an appropriate option for you. One key thing I wanted to mention is this is not going to help anything thumb related. So if you have a thumb injury, thumb arthritis, a scaphoid fracture, because the thumb can move here, this is not the brace for you. Moving on in the different bracing options, this here is a more rigid form of a wrist splint, and you'll see here it's got the thumb attachment. So we call this a thumb spica splint. So the splint is also still very stiff over the wrist joint. So can't flex it, as you can tell, can't extend it, can't ulnarly deviate, can't radially deviate, but I also now cannot bend my thumb past this joint here. So while this wrist splint can be used for everything else the prior one could be used for, arthritis of the wrist, tendonitis of the wrist, instability of the wrist, carpal tunnel syndrome, this is very specifically also meant for thumb issues. So you'll see a lot of people who get something called a de Quervain's tenosynovitis, where the thumb tendons here get inflamed. This is very helpful. Thumb arthritis and thumb ligament injuries are another two big indications for this. The last type of issue I will use this type of splint for is someone who's got a scaphoid injury or a scaphoid fracture, where I need them to be in a cast-like splint for at least 6 weeks to allow the bone to heal. So this here is a splint that a doctor would really want to prescribe for you, and not one I'd recommend that you just pick up over the counter without speaking to why you want to immobilize the thumb joint. So next we have the wrist widget. So what does this wrist widget do? It's meant for people who are experiencing ulnar-sided wrist pain. So ulnar-sided wrist pain is pain on this area of the wrist. Now the differential diagnosis for this is large, but the most common area that is injured in this area is the TFCC. So a lot of people have TFCC injuries or TFCC tears, where they can no longer do push-ups or push off their hands. Other areas implicated in here are your extensor and flexor tendons, as well. You can get a little bit of scaphoid lunate instability. So how this wrist widget works is it applies pressure so that it compresses the joint like this, so that you have added stability in the ulnar aspect. So when you're doing things like push-ups, or if you're doing like a clean press, for example, you're not feeling the pain that you would typically feel. The reason why I like this is it's relatively cheap, very minimalistic. You can still do push-ups on it, you can still rock climb on it, you can still play the piano with it, and a lot of patients find this very helpful. So next we have the CMC Push Brace. This is a very minimalist brace specifically made for CMC joint arthritis at the thumb. So I don't have a sample, but I'm going to put up some links above and some pictures above me as well. The CMC joint is this joint here, and it is the joint most commonly implicated in thumb arthritis. And the reason why is it's the reason why we can have 6 different degrees of motion in our thumb, and we have that opposition. So instead of using this giant wrist splint that's a bit overkill because it also immobilizes the wrist, they've now developed these push splints that will be very minimalist, and they just stabilize this area of the thumb so that you can still move the thumb like this, but it offloads that area here as you're working. Patients really like this because it is minimalist. A lot of them are waterproof. They can use them at work, but it still helps stabilize the joint. So it's a very effective option for people with arthritis at the CMC joint, potentially even this joint here, the MCP. Can potentially also be used for thumb ligamentous injuries, but usually in those cases, I actually recommend the thumb spica that I spoke about a little bit sooner. So next we have a finger splint. So a finger splint, I'm going to put some pictures beside me, essentially is a splint that will prevent the flexion and extension of a finger. It's a very common splint that a lot of people will pick up at the drugstore on their own, especially when they've dealt with a finger injury. So in many cases, when you jam your finger, you get a bit of an extension or a flexor tendon injury, or you have even a small little fracture at the tip of the finger. Many physicians will put you in a little splint for approximately 6 weeks while things heal. The other very common reason we'll use a wrist splint is in people with a mallet finger. So sometimes this tendon here gets disrupted and the finger is stuck like this. So the way that we have to fix that tendon is we actually put them in a mallet finger splint so that they stay like this for a minimum of 6 to 8 weeks to allow that tendon to heal itself. So this can be quite effective. Usually I don't recommend immobilizing fingers unless there's good reason to do so, because fingers will stiffen up very quickly. So in a lot of cases, these splints are prescribed by either ER doctors, sport medicine doctors, or orthopedic physicians. And last but certainly not least, we have KT tape. So this can be quite effective in taping a variety of tendons, joints, and ligaments. And I find that a good athletic therapist, a good therapist as a whole, can actually show you how to tape the different areas that you're experiencing pain with. You'll see this in a lot of athletes because it's harder to actually compete with a lot of the braces that I used. And this here can get wet, it can move, it provides a more mild base of support, but in many cases that's enough to keep you going on in your activity. So don't negate the benefits of KT tape, because that's still something I recommend to a lot of my patients. So that concludes my brief overview of the different types of elbow, wrist, forearm, finger, thumb braces available to patients. I'm going to leave links down below if you're interested in learning more about them. Now, if you have any questions or comments, leave them down below. For now, that's all.